High blood pressure in pregnancy. Some women already have high blood pressure, hypertension, before they become pregnant, and they may be on treatment for this. You can also develop high blood pressure whilst you are pregnant, which returns to normal after your baby is born. This is called gestational hypertension. What is high blood pressure? If you have high blood pressure, hypertension, the pressure of the blood in your blood vessels, arteries, is too high. Blood pressure is recorded as two figures. For example, 140/85 millimeters Hg. This is set as 140/85. Blood pressure is measured in millimeters of mercury, millimeters Hg. The first, or top, number is your systolic blood pressure. This is the pressure in your arteries when your heart contracts. Normal blood pressure is below 140/90 millimeters Hg. During pregnancy, mildly high blood pressure is blood pressure between 140/90 and 149/99 millimeters Hg. The systolic or upper number is between 140 and 149, and/or the lower or diastolic number is between 90 and 99. Moderately high blood pressure is blood pressure between 150/100 and 159/109 millimeters Hg. The systolic is between 150 and 159, and/or the diastolic is between 100 and 109. Severely high blood pressure is blood pressure of 160/110 millimeters Hg or higher. The systolic is 160 or more, and/or the diastolic is 110 or more. Our blood pressure goes up when we are anxious or stressed, such as when we have to rush. Some people find it stressful seeing a doctor or midwife. It is important to give yourself enough time for your antenatal appointments so that you can relax and your blood pressure is not higher than it normally would be. What are the different types of high blood pressure in pregnancy? Pre-existing high blood pressure. Some women already have high blood pressure before they become pregnant, and they may be on treatment for this. Your medication may need to be changed, so it is important to see a healthcare professional. Some women are found to have high blood pressure before they are 20 weeks pregnant. If high blood pressure is first discovered before you are 20 weeks pregnant, this usually means that you had previously undetected high blood pressure before you were pregnant. So, high blood pressure before 20 weeks of pregnancy is not caused by pregnancy, but is pre-existing, or chronic, high blood pressure. Gestational high blood pressure. Some women can develop new high blood pressure during their pregnancy. This is called gestational high blood pressure or pregnancy-induced high blood pressure. Gestational high blood pressure is high blood pressure that develops for the first time after the 20th week of pregnancy. Doctors can confirm this type of high blood pressure if you do not go on to develop pre-eclampsia during your pregnancy, and if your blood pressure has returned to normal within 6 weeks of giving birth. If you have gestational high blood pressure, you do not have protein in your urine when it is tested by your midwife or doctor during your pregnancy. How common is high blood pressure during pregnancy? High blood pressure, hypertension, during pregnancy is quite a common problem. About 1 in 10 pregnant women have problems with high blood pressure. Up to 3 in 100 pregnant women have pre-existing high blood pressure. About 4 to 8 in 100 pregnant women have gestational high blood pressure. What are the possible problems with high blood pressure during pregnancy? The risks to you as the mother: an increased chance of having a stroke, damage to your kidneys and liver, an increased risk of blood clotting problems, an increased risk of severe bleeding from your placenta. The risks to your baby: an increased chance of poor growth, an increased chance of premature birth, an increased chance of stillbirth. Thanks for watching. If you liked the video, please like and subscribe to our channel HC Tips for our supports.